On this podcast, we're going to be talking all about women's health. I'll be joined by one of the nation's foremost gynecologists, and we're going to talk all about reproductive health and all those questions that you wanted answered, or maybe some of these things that you believed that just aren't true. So we're going to talk about the disparity between men's and women's health throughout the centuries, really, throughout healthcare. We're going to talk all about PCOS. What is PCOS and how do you treat it? And maybe what are some of the misconceptions about it? And we're going to go through a really fun real or sus question and answer. So we're going to go over viral videos that have gone viral, let's say on TikTok, on Instagram, about women's health and whether the claims made in these videos are real or whether they're sus or not true. Okay, so before we get started with this fun and engaging interview with Dr. Karen Tang, let me give you an introduction to her real quick here. Dr. Tang is a board-certified gynecologist and minimally invasive gynecologic surgeon. As at Karen Tang MD on TikTok, Instagram, and YouTube, she makes videos debunking misinformation about topics like period problems, birth control, menopause, gender, and sex. Her goal is to break down the stigma around women's health and empower people to understand their own bodies. Her book, It's Not Hysteria, Everything You Need to Know About Your Reproductive Health, But We're Never Told, will be out literally the Tuesday after this podcast comes out. So it will be out May 7th, Tuesday, May 7th. So let's get started with my podcast interview with Dr. Tang. I think you're really going to enjoy this one. Well, thank you so much for joining me, Karen. This will be a lot of fun.
I cannot wait. I was so excited when you invited me to do the podcast.
Oh, thank you. Okay, so I'd like to start by actually reading something from your book. And because this really, your book is called It's Not Hysteria. Mm-hmm. So I'd like to read this from the book. I'd like to get your comment on it, and let's get started here. Women's bodies and medical concerns have been misunderstood, mismanaged, and outright dismissed since the beginning of recorded history. The fathers of Western medicine and philosophy, who were greatly respected for their pioneering work in some regards, put forth many theories about women's health that sound absurd today, but were accepted as gospel for generations. For example, if a woman exhibited symptoms that couldn't be explained, she was said to be suffering from faulty sexual organs, witchcraft, or the catch-all explanation, hysteria. Now, your book, Dr. Karen, is called It's Not Hysteria. So can you tell us about the history of this term and what this term represents and maybe represents to you today?
Absolutely. So it is a little sad that something like hysteria, which started, really like in ancient times, like still today has reflections on how we treat women, especially in medicine, especially in a lot of like women's concerns that are still oftentimes dismissed or sort of thought of as, like mysterious. And the concept of hysteria started like even in ancient Greek times, like they actually thought that your uterus literally moved around your body. The word hysteria comes from the word for uterus in Greek. It's hystera. So they literally thought that your uterus was just out of control. It moved all around your body. It was seeking out sex and pregnancy. And the treatments that people had for medical conditions were honestly things like, well, you should have more sex. You should get pregnant. And I make the point in the book that, it sounds absolutely crazy to us now, but honestly, there are some reflections of that in how people are treated today. For instance, for endometriosis, people are still told by their doctors to get pregnant to treat it because sometimes the symptoms do get a little bit better with hormone fluctuations. Obviously, that's not a long-term treatment option. Like you can't just stay pregnant forever. But, so we still, even though we think we're so advanced medically and we have all this data and science, in a lot of ways, some of these really old-fashioned concepts of how we think of women's bodies are still seen in how we treat women now.
And one of the things that you do is you start your book by going over kind of the history of women's healthcare and how absolutely off the mark it has been for so long. Mm-hmm. And there are some terms that you use that I had never heard of. And so I'd love to hear you tell us a little bit about it. Tell us, what is the rest cure?
So anyone who's read the book, The Yellow Wallpaper by Charlotte Perkins Gilman, it's sort of a really classic feminist short story. It basically was based in a real cure that was used for many years, like in the 1800s. It was actually a lot of very wealthy women were subjected to this breast cure. The idea was that back to the idea of hysteria, like you were too worked up, like you were too nervous and anxious. So you needed to just rest yourself. And truly, these women were just kept literally isolated in rooms and just told to not do anything. They couldn't think, they couldn't work, they couldn't write. So Charlotte Perkins Gilman wrote this very classic story where this woman, basically was driven mad by this treatment. And she started out just a little bit anxious, but just the idea that she was kept so infantilized that she
Hmm.
really had lost control of her body, her mind, and it sort of drove her to madness. And that was a real thing. So several very famous women, Jane Addams, all these like very, famous intellectual women had actually gone through the rest cure. At the time, it seemed like it was the height of you were being pampered, you were being cared for, but truly it was quite harmful to them. So I kind of make the extrapolation that in today's medical treatment, there are definitely some things that it seem on the surface are helpful, but in a lot of ways they actually cause more symptoms or more harm than good. For instance, birth control, antidepressants are very helpful for so many people, but there are some patients who actually have worse symptoms when they're on that. They feel like they have worsened mood symptoms or they have other physical side effects. And sometimes doctors will just keep on pushing those medicines, even if the patient's saying, oh my God, this is actually making me feel worse, not better. So in a lot of ways, again, there's that little bit of the continuity of that theme that we're trying our
Hmm.
best, we think we're doing something good, but in some ways it's actually making the patient feel worse.
I mean, it sounds like throughout history there has been this belief traditionally propagated through the medical establishment, which has mainly been males, that a lot of women's health problems are in their head,
Mhm.
and that's caused by them overreacting to maybe things that aren't real or aren't shouldn't be reacted to the way that they are.
Mhm.
Is that something that when you went through your training, did you feel that, or did you see that in your training and how physicians were treating their patients?
Yeah, and I make the case that this idea of hysteria, it has so many things wrapped up in it. It's your mind, your anxiety, manifesting as physical symptoms. There's a whole section of mental health disorders, these somatic disorders, where is there something that you're feeling as a physical symptom, but we don't know what it is, so we're just kind of going to assume that it's in your mind.
Hmm.
And women to men, it's like a 10-to-1 ratio of people diagnosed with
Yeah, I
somatic
read
symptoms
that.
are mostly women. And in general, I would probably guess that there's probably some sort of physical condition going on. We just haven't found it yet. So in training, I do feel like, especially in, say, women's health spaces where there isn't a lot of research or data, we don't have as established treatment algorithms as things like, heart attacks or management of diabetes. So into that space where there's a lot of uncertainty, if we don't have
Hmm.
great answers to tell a patient, we're kind of like, well, maybe you're just imagining it. So with women's health, there's very little research on these things. So a lot of times we don't have a great, say, test for endometriosis except for surgery. So there's no blood test, there's no like EKG where we can see like on an actual diagram or an objective reading that yes, you have this. So you may hear someone say, and these are all very classic symptoms of endometriosis, you have severe pain, you have bloating, you have bleeding, you have diarrhea, you have constipation, you have migraines, fatigue. Those are all symptoms of endo. But if you hear that laundry list of symptoms in medicine, we call it like the pan positive review of systems. Like when we review every organ system, you have issues with
Hmm.
almost all of them. The assumption is, well, that can't be from one physical malady. Like that's got to be in her head. So in so many things, you do sort of get this in training even, wow, we can't find one thing that actually explains all that stuff. It must be psychosomatic or must be in their mind.
And I mean, have you seen, as somebody who does look in the literature, and obviously as a gynecologist, you're treating all women, how much are you seeing that the studies that are being done are still being mainly focused on men? Obviously, with GYN, that's different. I mean, is there still a real big difference in how much time, money, and effort is spent studying diseases for men than for women?
Absolutely. So when you look at the funding for different research conditions, and in the book I talked about the research funding for different conditions for women as opposed to other general things like diabetes or high blood pressure, heart disease that affect everybody. I found this very shocking statistic, which my mind is still blown by this, that in 2022, the NIH spent twice as much funding research on smallpox as they did on endometriosis, which affects 10% of women. But smallpox was
Smallpox is
eradicated in
basically eradicated.
1940s. It got totally eradicated in the 1940s. Nobody has smallpox. But the reason it's funded is because it's thought to be a matter of national security. We're protecting against biological warfare. Like, that is more important than the actual suffering of women. So, we mentioned in a little talk before we started recording that, the NIH didn't mandate that women be included in NIH funded studies until like 1993. Like, so all these big major studies on things like heart disease were only conducted on male study participants. So in so many ways, we're still catching up on how things affect women differently. I made the example the other day of some things like menopause affect how your body, has risk factors for heart disease, your cholesterol levels. And none of that was sort of factored into some of these groundbreaking major studies. And so I do feel like we're definitely catching up, both on, how women's health is different than men's health in general, but also particularly in areas of, gynecologic issues.
Yeah, I think there has been always a belief with some of these diseases like diabetes and heart disease that both men and women have, that, we can study it in men, and women are essentially just smaller men.
It's small men.
Like, no, yeah, that's not the truth. That's not how it works. And I mean, one of the other things I'd love to ask you about is insurance reimbursement, because we know that insurance reimbursement is the driving factor in everything in healthcare. I was thinking about making a TikTok video about like, who really drives healthcare, who makes healthcare decisions in this country. And you'd think, okay, like that, the layperson would say, well, the doctors make the decisions for patients, right? And then maybe followed by the nurses. And it's like, no, actually the insurance companies make these decisions. And by them deciding how much they're going to pay for procedures, that's going to determine how often those procedures are performed and whether they're even performed at all. And how does that differ between men and women when you look at insurance reimbursement?
Oh, this is a huge topic. So when you think about the complaints that people have about OBGYN in general, the appointments are rushed. They don't spend much time. They only spend like 2 minutes and then they have to run out of the room. I feel like my concerns aren't listened to. So many of those things are tied to insurance. So for instance, I don't do obstetrics, which is care of people in pregnancy, but OBs who do, they get paid something like $2,000 to $3,000 for an entire pregnancy, 10 months of care, plus the delivery, plus the postpartum visits. So you can imagine they're seeing so many patients because, like to keep the doors open, you have to see a certain number of patients to even be able to pay your staff and pay your rent. So, their appointment times are quite short because they're seeing a lot of people to, work with this crazy model. We say sometimes the anesthesiologist makes more for the, epidural than the OB makes for almost a year's worth of work. For GYN surgery, that's my specialty, is minimally invasive surgery. We could spend like 4 hours doing an extensive endometriosis surgery with bowel adhesions, inflammation. It's an incredibly difficult surgery, and it's paid a fraction, like an order of magnitude less than other surgeons for surgeries that may take less time. So in pretty much everything in gynecology, the reimbursement is less than the equivalent in urology. Like, there's been some amazing presentations I've seen on this where they show side by side the reimbursement for the women's equivalent, prostate biopsy versus uterine biopsy, like vasectomy versus tubal ligation is always much less. And so that also leads into, like people going into the field. Like I've talked to several gynecologists who went into surgical GYN and were told, like, well, why would you waste your talent? Like, why would you go into that field? It pays the least. It has, the highest malpractice. It has the worst hours. So there's definitely barriers to people going into the field as well. And that perpetuates the access issue. Like, people in certain rural areas have a very difficult time finding even an OBGYN these days because, they are, burning out. They are, malpractice is too high, like labor and delivery, units are closing down. So there's a huge systemic issue, that kind of comes down to the money. It comes down to the reimbursement. And for my specialty, I actually just, changed practices to become an out-of-network doctor. Pretty much everyone in my specialty is out of network. There's no way to keep the doors open. Wow. to
Yeah.
be, especially we focus on pelvic pain. We spend like
Hmm.
45 minutes with a patient just in the first consult, and then the surgeries
Yeah.
take so long. There's no way to keep the doors open. So, that's a
Yeah.
huge systemic issue.
And this kind of global payment period where you get one payment for treating somebody before they have a baby, and then during and then after, is a disincentive for them to spend more time with their
Mm-hmm.
patients, because you don't
Yeah.
get paid more necessarily if you give
No.
more comprehensive care. You get paid the same.
Mm-hmm.
I think it is kind of an unfortunate situation in our society where you could be the kindest doctor who gives the most care and spends a ton of time with your patients, and you're going to get paid the same as somebody
Mm-hmm.
who doesn't at all.
Yeah.
And the quality of your care a lot of times doesn't make any difference in what your reimbursement is. So what
Yeah.
do you think needs to change in healthcare to help create better equality then for women?
Oh man.
Because that is obviously a major issue that we have.
Yeah, it's tough. And I kind of say in the conclusion of the book, you basically have to transform the entire medical system, but we're
Mm,
going to have to do that if we want to serve patients right. So recently, they just announced, President Biden, First Lady Jill Biden just announced this major initiative to increase something like $12 billion of funding for women's health research
mm,
and, like health initiatives, which I was so excited to hear, because you truly do need not only the funding to support the research, the data, so that we can be more evidence based and treat patients correctly. And also, you need to support the training. Like, you need to invest in both the training of OBGYNs, it reimburse better so that people can spend more time to figure out these very
mhm,
complex issues. Things like infertility, PCOS. We're going to talk about PCOS later. Menopause, like, these take a long time to sort out. There are so many health issues associated with it. Basically, every aspect of your physical and your mental health is affected. You can't fix that in 15 minutes.
mhm.
So just to be able to get the reimbursement so that people can get that care that they need. Like I said, a whole lot needs to change. We also need to improve education. That's why I wrote the book. Is so much of women's health or sexual health is thought of as like kind of taboo. Like, people like don't talk about it. We don't get good sex ed or reproductive education in schools because there's so much kind of politically, you're not supposed to talk about sex. You're not supposed to explain
Mhm.
about that. So then people don't have this information about their bodies. And then, they're stuck in these patterns of, I don't know if this is normal. I'm not getting great care. I don't know what to do. So, I wrote the book largely in part in response to that, and feeling like I needed to do something so we could get these
Mhm.
conversations started.
So her book is called It's Not Hysteria: Everything You Need to Know About Your Reproductive Health, But We're Never Told. I was very fortunate to get an early copy of Dr. Karen Tang's book. And essentially what it is this is a guide for all women to know basically their bodies and to know all the different types of diagnoses that are out there. And so it goes from fibroids to endometriosis to urinary incontinence, sexual dysfunction, PMS, menopause, infertility, cancer, birth control, and all these other types of things. And so, really, this is kind of a catch all book for anybody who is of the XX chromosomes. And you're
Or
wondering, why
other.
is my body acting this way?
Mhm.
And what are some of the different diagnoses? Maybe my doctor did give me a diagnosis and I don't really understand what that means.
Mhm.
Her book will really explain it to you in layperson's terms, but also give you a lot of options, from medical options that maybe are traditional medicine focused, but also you give, which makes me happy, holistic options
Yes.
too,
Mhm.
which I think is what a lot of people are looking for. They don't just necessarily want a pill. They
Mhm.
want to understand, like, why is my body acting this way? And what can I do myself based off of what I eat, by my activity, by my lifestyle, to help improve it? And
Mhm.
also, if medication can help too, all that can kind of work together. So I want to kind of shift gears a little bit. Now that we've kind of talked a little bit about how the women's health system kind of here in the United States is pretty screwed up. Um, One of the most common diagnoses that I think that is really not understood is guys don't get it. Okay, I'll tell you, if you mention PCOS to a guy, my guess is
Forget it.
that
Yeah.
less than 5% of guys will understand what PCOS is. And the only ones that probably do are the ones who have partners
Mhm.
and they've been trying to conceive and it's just not working. Maybe though, but otherwise, I think most guys just don't get it. So I'd love to talk a bit about PCOS because I think it is a very misunderstood and a very common women's reproductive disorders. So
Mhm.
can you first, Karen, tell us what is PCOS?
Sure. PCOS is very hard to understand. I think even for medical people, it's such a strange concept. So, PCOS stands for polycystic ovarian syndrome. And a syndrome just means that it's not one thing, there's not one enzyme, one gene that causes it. It's a group of symptoms. So, to be diagnosed with PCOS, you only have to have two out of three things. So, one is polycystic ovaries on ultrasound, which is basically the cysts are tiny follicles. It often has problems with ovulation, so that if you don't ovulate regularly, you have lots of little follicles or developing eggs that are trying to be released, but they can't. And so this ends up being visible on ultrasounds as lots of tiny little follicles. The second is signs of excess testosterone or male hormone, which can manifest as things like excess facial hair or body hair or acne, or
Mhm.
people can have high testosterone levels on their blood work. And then the third is missing or irregular and frequent periods. So you don't ovulate as often. And if you don't ovulate, you don't have a period. So oftentimes people with
Mhm.
PCOS will skip several months or even a year or more worth of periods. So you only have to have two out of those three things to be called PCOS. So like weirdly, you don't have to have polycystic ovaries to have PCOS, which is a very, strange concept. Like
Yeah.
it was named very poorly. Um, and the other thing that's very common with PCOS is what we call metabolic disorders. So you can have a higher risk of things like diabetes, insulin resistance, high blood pressure, high cholesterol. So we think that it has something to do with your metabolic system tied with your hormone system. And then it sort of all, goes awry a little bit. So there's been more and more research recently on the tie with blood sugar and insulin levels. And I think that's where it's going to be
Mhm.
interesting for us to talk about it, with your approach, being a holistic doctor, because so much of PCOS management isn't just as simple as like take this hormone,
Mhm.
because we do start to think about the whole body, nutrition, exercise. Traditionally, PCOS in the past was sort of thought of as something that was tied to always being obese, but that's not the case. Obviously,
Mhm.
people are of all body sizes and weights and get PCOS. So the tie with the weight, it used to be kind of, back when I was training, we were just kind of starting to shift out of this mindset of like, oh, you tell PCOS patients to lose X pounds. We don't do that anymore.
Mhm.
Obviously, it's about the
Hmm.
approach to wellness and to nutrition, and also looking at things like your blood sugar and your insulin and your cholesterol levels and kind of working around those things. PCOS
So you
also, oh, sorry. PCOS
no, go ahead.
also
I'll keep going.
has an increased risk of things like infertility, because if you're not ovulating or releasing eggs regularly, it can be harder to get pregnant.
I think that one of the difficult things, I think, just like you mentioned earlier, that makes PCOS so confusing is because you only have to have two of these three symptoms. And so,
Mhm.
once again, you mentioned, okay, you could have irregular ovulation. So basically irregular periods, and you could have, let's say, hirsutism, which is like a male pattern hair growth in a female, yet not have any polycystic
Polycystic
over
ovaries.
like
Mhm.
cyst. Yeah, like
Yeah.
that would be fine.
Mhm.
Or you could have polycystic ovaries and hirsutism, facial hair,
Mhm.
yet have regular periods.
Mhm.
So I
Yeah.
think that in and of itself makes it confusing because normally you think, okay, you have a diagnosis and it's like, okay, this results in this, which results in this, but there
Mhm.
isn't this kind of direct, cause effect situation that appears with PCOS. And you even
Mhm.
mentioned, I think that how much does being overweight contribute to it? Well, it could be a contributing factor, but as
Mhm.
you mentioned, there are people with PCOS who are real thin.
Mhm.
So it really makes it such a confusing diagnosis, I think, especially for lay people where they
Yeah.
don't understand the underlying physiology as well as a physician.
Mhm.
I mean, how confusing can that
It's
get?
very confusing. I honestly think
And
it
and the
probably will
treatments
end
make
up
it, yeah.
being different types of conditions. Like, maybe down the
Hmm.
line when we have more data, we'll find that there's actually slightly different diseases even that have been kind of
Hmm.
grouped under this big umbrella. Maybe people with more of the metabolic issues, people with more of like the hormone fluctuations, may actually have different conditions. So.
So then when you get somebody who comes in with PCOS, you're essentially going to focus on which symptoms they have.
Mhm.
And that in of itself then makes it a very personalized care approach because you can't just treat everybody the same way who have
Mhm.
PCOS.
Exactly. We end up, or at least, when I approach PCOS patients, always ask them what their goals of care are, because sometimes their main goal is to get pregnant. So this only came up because they've been trying to get pregnant, they've had issues, or somebody may be coming in because of their period irregularity. So sometimes if people skip many periods, when they finally have a period, it ends up being very, very heavy or very long
Hmm.
because they're almost having like 3 or 4 months worth of periods all at the same
Yeah.
time. So they're trying to control some of the bleeding symptoms, the unpredictability of the period. So we always have to ask them, what is concerning you and what is the issue that you need to take care of and how can we address that? And we go through all the different treatment options. So it's definitely, no longer like, okay, well, you need to take this birth control and do X. Some people still do it that way, but we should ideally be approaching it in a very personalized way.
What do you think about trying to find the root cause then? Like, what do you think is
Yeah.
what are some of the beliefs of the cause of this? Or is it
Yeah, that's
just a
tough.
kind of big unknown then? I mean,
I know. I when I was writing the book, like when I started every chapter, they almost
yeah,
had the exact same sentence. Where like, we don't really know what
yeah,
causes
I noticed that.
PCOS, fibroids, endometriosis, because truly, again, we don't have like a gene or some like actual pathophysiology for PCOS. There's more and more some thought that it is tied to insulin and blood sugar
Mhm.
control, because something like I think 70% of PCOS patients will be either insulin resistant or diabetic, and some of the
Oh
treatments
wow.
for diabetes do actually seem to regulate the hormone imbalances and the cycles in people with PCOS. So, for many, many years, people were using metformin, which is a
Mhm.
medication for diabetes. Nowadays, that one's fallen a little bit out of favor because other treatments are more effective, but the concept is the same. That's something about regulating, blood sugar, insulin seems to kind of normalize some of those hormone imbalances. Something that people are starting to look at is something called inositol, which
Mhm.
also seems it's a dietary supplement that seems to also improve things like blood sugar. So I know some fertility doctors even prescribe that or recommend it to their patients as well. So.
Are you hearing about any doctors prescribing semaglutide for PCOS?
I don't know specifically, but I'm sure some are. Like, I think as part of kind of the bigger picture of weight management and things like that. If someone has PCOS and is obese, then sometimes like losing weight in a healthy way does seem to help to normalize some of the hormone issues and the cycles. So I'm
Mhm.
definitely sure that some OBGYNs have started to prescribe semaglutide.
Mhm. All right. So one of the big things that got Dr. Karen Tang, one reason why she got a big book deal for It's Not Hysteria is because she's got a massive audience on social media.
I have
She's
like a
very
tenth the
active
audience that you
on.
do.
That's okay. That's still
Dr.
that's
You
still
just like
huge.
very, very,
But
casually
you've
being
got
like, yeah, yeah.
you've got a big
I
audience
was,
on TikTok, on Instagram, on YouTube, and so one of the things you enjoy doing, which I love doing myself, is dispelling various myths,
yes,
misinformation that's online, and God knows, we both know there is so much misinformation on
so
TikTok.
much.
And even I have gone and I have corrected some of these things. Me, a plastic surgeon, when they're talking about certain things. So what I'd like to do is go over some of the viral videos that have gone viral on TikTok and other platforms, and we'll do a bit of a real or sus.
I love
So
it.
for my listeners who have not heard of my real or sus kind of series, it's basically fact or fiction. So real obviously means real. Sus means suspicious or like fake or not true, or cap is another term that the young people are using. So I'm going to ask you for some of these, and we'll go into a little bit of detail, not tons of detail, because I got a bunch of these I want to go through. And
Nice.
some of these, you guys, listeners, you're going to really
Oh
think are
God.
just funny, but
Yeah.
it's great. Okay, so real or sus? You can stop your period by drinking a homemade concoction of Jello, lemon juice, and ibuprofen.
So I
So
made a
this was
video about this. Yes. Yeah.
yeah, this was a claim that was made that I think somebody said, "Oh, I've got a big event, and my friend showed up today, so I'm going to take this concoction of Jello, lemon juice, and ibuprofen, and it's going to delay my period for a day." Real or sus?
So partly real. So I made a video about this because the part that actually works is the ibuprofen. So I was saying you don't need the Jello and like the lemon juice and all the other crap. So ibuprofen and other NSAIDs, the non-steroidal anti-inflammatory drugs we've known for a long time, actually decreases period bleeding. So in the
Hmm.
rest of the body, it increases bleeding. Like we tell people, be careful with it right before
Yeah.
surgery because you could bleed more. In the uterus, it makes you bleed less because it decreases prostaglandins, which make your uterus
Hmm.
contract and squeeze out menstrual blood. So we actually prescribe it sometimes as a treatment for heavy but also painful and heavy periods. It does significantly lighten the bleeding. We say you do have to take a substantial amount to get it to noticeably lighten. So we tell
Hmm.
people, obviously, like, don't just go out and just like chug a whole bunch of ibuprofen because there are some risks. You
Yeah.
can have other
Oh, yeah.
bleeding from other parts of your body, like your GI system. You can cause ulcers and kidney problems. So don't just go out and take a bunch. But, for people who are under the direction of their doctor, you can take higher levels and it can decrease your bleeding. Now, it probably won't be enough to completely stop it for a long time. Like the person in the video was like, oh, I'm on vacation. I just want to, stop my period. We always tell people, if you know you have something coming up, like a trip, like see your gynecologist. We can do other things that are more effective, like give you
Hmm.
progesterone or birth control pills that are more likely to stop your period totally.
Okay. So it's real,
Sadly real,
kind
I
of.
know.
Okay.
Partly sus, partly real.
All right. Real or sus, Dr. Karen Tang. It's normal for women to get stabbing butt pain during their periods. Stabbing butt pain during periods, it is normal. Is that real or sus?
So sus, so sus. Do not let anybody tell you that any sort of severe pain is normal with your periods. Especially stabbing butt pain can be a sign of endometriosis. Endometriosis
Hmm.
very commonly grows right next to your rectum. So one of the signs is you have stabbing pain. And I'll tell you, I actually just talked at an endometriosis conference for patients this weekend, and a person came up to me and said that she had seen that video of mine and gotten diagnosed with endometriosis because she was like, oh my
Oh,
God, I have
wow.
stabbing butt pain. So she went to an endometriosis specialist, had surgery, and it was endo. So I was like, oh my God, my
Hmm.
TikTok is actually helping people. But it's true. It's a very common symptom. Like those videos about the butt pain get millions of
Yeah.
views and
Oh, yeah.
thousands of comments of people saying that they have it. So it's not normal. It can just be from things like muscle spasm, but it's not
Hmm.
something you have to just tolerate. So if you're having, ow, it's
Okay.
stabbing me in my rectum, go see your doctor.
All right. Real or sus? The more partners, and this is something that's been a belief for centuries. Real or sus? The more partners a woman has, the more her vagina is stretched out.
God, so sus. I mean, I said in the video, how would the vagina know? Like, it's not taking attendance. How would it know it's one partner 100 times or 100 partners one time? There's no way to tell. So no, obviously it's sus. Like, there's no way for the vagina to like record attendance and be able to tell. And the vagina's elastic. It's meant to like stretch to give birth. Like like different partners is not going to like kind of permanently stretch out your vagina. No.
Okay, so you don't need. What do you think about vaginal tightening procedures and treatments? Now, that's something that I know there are plastic surgeons who are doing
Mm.
it. There are gynecologists doing it. I actually looked in your book. I didn't see a whole lot on some of these treatments. So, what are your thoughts on them?
Yeah, so I kind of talk about treatments for things like pelvic organ prolapse, which is like where
Yeah.
officially the laxity of the walls of the vagina become very weak, usually because of having, history of childbirth or being after menopause. Things get weak structurally, and say your bladder may prolapse a little bit into the vagina or the rectum. The opening of the vagina can widen after childbirth, and that can cause structural issues because the floor of your pelvis and the opening of the vagina are
Yeah.
actually kind of part of a support structure that keeps all the organs in place. So, from a medical perspective, we do those surgeries as part of repairs of prolapse, not necessarily just because, oh, I just need to tighten things up so my partner will feel like things are more pleasurable. I tell people that
Mhm.
that's not okay. But people generally do need those surgical repairs in cases where, the bladder's falling, they're having like issues with, like bulges, pressure in their pelvis, and or very commonly they have issues with like urinary incontinence as well because
Yeah.
everything gets a little bit weak. So I am very dubious of people who are like, oh, I'm a plastic surgeon, I'm just like tightening it to cosmetically make it more pretty. There is a
Mhm.
separate condition or a separate procedure called labiaplasty, which is more related to the length of the labia minora or the lips. Like that's a different thing. For people who the lips are getting caught in like your clothing or during sex or exercise, like we do like, surgically like shorten them and reconstruct them a little bit just so that functionally they're not causing problems with like sex or exercise. But just to kind of like literally tighten the opening, it's almost always in the context of my husband wants it to be tighter. Like that's gross. Like that, no, like you don't need to do that. But honestly, if you have functional issues with like your bladder, your bowel, like you're feeling pain or pressure, like with sex, then there are surgical repairs for that. It's also pelvic physical therapy. Sometimes just physical therapy helps.
Okay, this term, this question went viral and I do not understand it, but I think you do. So let's see if you can make this is.
I'm curious what the
let's
question
see if you can make something of this Gen Z slang, which even I don't get. Okay. All right. Listen very carefully. Audience, listen very carefully because let's see if you understand what I'm saying here.
Oh my God.
Once I yet the uterus, does the garden still bloom?
Once I yeet the uterus. Once I yeet the uterus. Yeah.
Does the garden yeet the uterus? Does the garden still bloom? What are they asking here? I have no idea.
That was about hysterectomy. That's once you take the uterus out, is like sex still happening? That's the question. So
I'm thinking garden still like
I love that question. Oh my God.
What bloom? Like, is it like
just like sexual blooming? That's.
They're talking about like candidiasis.
Like, oh my God. What? Oh no! Oh my God! But the question was somebody.
I was confused. Okay.
Yeah, there was a video that went viral. A woman who was like, once I eat the uterus, is the garden still blooming? So people have this concern a lot that they've heard rumors that once you have a hysterectomy or your uterus is removed, you're not going to have like any libido. You're going to have difficulty with like lubrication or sex or orgasm. And the answer is no. That's actually been very, very well studied. There's of all the things in gynecology, hysterectomy and sex has actually been studied a lot in many studies.
Yeah, that's because the guys, that's all they care about.
I hate to say it, but it's like, if there's some impact on men. But if you do not take out the ovaries, because the ovaries make the hormones, the word hysterectomy only refers to the uterus. So again, that's sort of a myth. Like people associate the word hysterectomy with menopause because they think that the ovaries are getting taken out. It used to be the case like that actually, long ago, they did sort of always take both. But nowadays, when we talk about hysterectomy, we're only talking about the uterus. Very rare do we take out the ovaries unless someone is like already like postmenopausal, there's a cancer risk, that sort of thing. So if you leave the ovaries and the hormones are still in place, there is no difference in sexual function, satisfaction, orgasm. It even improves in some people. So when I responded to that, a lot of people said, and a lot of patients have told me, everything got better. And the reason is that you're getting rid of the stuff that caused the hysterectomy, like the pain, the bleeding, the fibroids. People were feeling super miserable before. So now that those are gone, they feel so much better. And sex, for women has so much to do with not just physical, but like emotional, mental stress. So once that they're just doing much better in all aspects, like the sex improves as well. So I always kind of reassure people that, it's that the garden is still blooming and sometimes it blooms better. There's sort of the question of things like the cervix. Like some people get like cervical orgasm. So we do have to talk a little bit about, what their personal feelings are about that. But in general, in studies, there's no difference, leaving the cervix, taking the cervix, the type of hysterectomy, if you do it with a big incision, small incisions, as long as you leave the ovaries. That's a good question.
Okay. Good to know. Yes. So now you know that if you yeet the uterus, the garden does still bloom, my friends. It does bloom.
I love you, Tony. Oh my God. Yeah.
Real or sus? Birth control can affect who you're attracted to.
Oh my God. I don't know what it is about that topic, but every like pseudoscience grifter influencer person loves saying this on TikTok, and I don't know why. So like there was some like crappy little study, and I looked into this because people were sending me this video of this guy being like, it makes you attracted to the wrong partners. And I was like, what the hell does that even mean? Like, how do you even test what the wrong partner is? Like, what does that mean conceptually? And he was referring to some like terrible, stupid little study where they literally gave people t-shirts to sniff. and they were like the t-shirts. If you were on birth control, the people you thought the smell was more attractive was like more genetically similar to you. So they're like, maybe you're going to pick a partner that's going to be like genetically related to you. I was like the craziest like extrapolation of, you know, like conclusion. So I tell people like, you know, if your birth control is somehow making you feel differently about a person where you wouldn't feel differently based on like their personality and your connection with them, like emotionally, mentally, spiritually,
Yeah.
like whatever, I don't know what to say, because it's almost like making people feel like, you know, women have no autonomy. It's like you're just like hormones, and like the only
Yeah.
thing that affects you is your hormones, and there's nothing else about you that's autonomous. Like that's so insulting.
Was
You know,
it
birth
mainly
control.
men
You know,
who were claiming this on the, or were
I
actually
saw
women also
two
saying
people who
that?
were men who said it. I don't know if a woman said it as
Okay.
well, but the two videos I
Okay.
saw were men, and I was like, come on,
I mean, maybe
take
that's
a
their
seat.
excuse of like, you know, they're being jerky, but they're like, oh, it must be her birth.
It
It's
must
like,
be
oh,
her
it's that
birth
time of the month.
control.
You know, it's
Oh,
like, no, it's actually not that time of month. You're
she's
actually just being annoying
brainwashed.
as
Yeah.
crap. Yeah.
Oh God. I
All
will
right. So
say
that is
anyone
sus.
who's saying sus like things like that, if it sounds sus, you know it probably is. Yeah.
Okay. So real or sus? Endometriosis is caused by using tampons that push the blood flow back into your abdominal cavity.
Oh my God.
That's why you get endometriosis. It's due to tampons that push blood back into your abdominal cavity. Is that real or sus?
God,
Do I
it's
even need to
sus.
ask this?
Nah, come on now. For anybody
All
who's
right.
just listening and didn't see the video of this, I like my eyes rolled so hard. It was like it was so, and this video made me so mad because for several reasons. One, there is sort of this old fashioned concept of, you know, where does endometriosis come from? Does it come from actual menstrual blood going backwards? It's called retrograde menstruation, and it comes from this idea that, you know, like some period blood does go backwards. It doesn't all come outwards through the vagina. Some does come out through the fallopian tubes and into your pelvis. So is some of it implanting in your pelvis and causing endo? You know, the endometriosis experts now do not think this, because people get endo all sorts of places. They can get it in their thorax. Men, cisgender men can get endometriosis. You can get endo in like your belly button.
Really?
Yeah. Oh yeah. All these are true. That's all true. Not
so
some.
I can get endometriosis?
Yeah. There's been several case studies, and it's always men with slightly higher than normal levels of estrogen. So like, you know, estrogen stimulates endo. Yeah.
Testosterone.
You're so,
so that's probably like Subio.
Virile.
Maybe we should let Dr. Subio know that could be a problem. Yeah.
A total aside, everybody, Subio and I are friends in real life. Like we actually operate at the same surgery center. So I thought I knew him in person before I knew that you guys were all like frenemies and stuff. But yeah.
Okay,
but back
so
back to the retrograde menstruation thing. So it's sort of a debunked theory. And also, you know, when I responded to this video, I was like, how hard do you think that we are putting tampons in? Like, you know, the force that it would take to shoot blood through the vagina, through the cervix, which is like a closed, it's not like a big hole. So it's like the cervix is closed. You have to force it through that, through the uterus, through the fallopian tubes, and then out into the pelvis, like with your tampon. Like, how would that even work? Like, what are the physics of that? So clearly sus. Annoyingly so. Yeah. All
right. Real or sus? Period poops are a real thing. Period poops are a real thing. Real or sus?
Yeah, that's real. So it's real. So that's back to the prostaglandins. So they basically can cause muscle contraction. So either cramps of your uterus or your, you know, colon can move more when you're on your period. So people can get more frequent poops or even a little bit of kind of like slight diarrhea with their period. Now, the caveat to that I always tell people is if you're having like a lot of diarrhea, really severe, or pain, that is where we're like, oh, maybe there's something like endometriosis. But a little bit of like, you know, like more frequent periods when you're frequent poops when you're on your period is a common thing. Yeah.
At what point would women should they be concerned and talk to their doctor if this is happening?
Yeah. I always tell people if something is affecting your quality of life or your ability to function, then that means it's abnormal. So a lot of people were like, is this normal? Is this something I should see a doctor for? It is sometimes hard to tell. So I tell people that, you know, if it's something where, you know, you're having difficulty going to work or kind of, you know, going and doing like the activities or exercise you usually like to do, it's affecting sex, something where your daily functioning is being affected by it. And that could be anything like heaviness of bleeding, pain, bowel problems, that's when you should see your doctor. I also say,
Mhm.
things that are common are not necessarily normal. It is sadly very common to have a lot of problems with your periods, but that's not a
Mhm.
reason to have to quietly suffer with them. So common does not
Mhm.
equal normal. And if it's affecting you, then it's abnormal and you should talk to someone.
All right, real or sus? The size of a tampon you use has nothing to do with the size of your vagina.
That is
Is
true.
that
Yes,
real?
that's
It's
true.
real.
And this is something that like blows people's minds on TikTok all the time, especially like men. You see like like when they quiz men about what does this size mean, and they oftentimes think it means how big the vagina is, and it's about the amount
Mhm.
of flow. So it's an absorbency size. So it's the absorbency of the tampon and the amount of fluid the tampon can hold. So people in general, again, because the vagina is elastic, the walls are like kind of folded and stretchy. So
Mhm.
you can use different absorbency tampons even if you've never been sexually active, if you have had children. So it's not based on sizing of you; it's about how much blood you're experiencing that day.
Real or sus? The Kardashian vaginal health gummies are worthless. Is that real? Are they worthless, or should people actually be taking the Kardashian vaginal health gummies? I
Oh
was
my
thinking about
god.
buying some for my wife. Should I?
Please don't. So again, I don't want to like have the Kardashian attorneys at my door, but to say that in general, I'll just
This is
extrapolate
your
to like
opinion,
all.
all your opinion. This is all your opinion, my opinion.
Yeah,
So we're
there
not
you go.
coming out with any factual. We're just saying this is our
We're just saying
opinion.
in general, yes. So no, you don't need any special gummies. I don't know what it is, but so many of these celebrities are like coming out with like vagina gummies and like vaginal deodorants and things like that. And in general, if you poll gynecologists, you do not need to do anything different to make your vagina smell differently, like be more beautiful, like be more like functional. The vagina has like a microbiome, which is bacteria that's normally there that actually does a great job of maintaining a normal environment. So
Mhm.
the bacteria keep the pH acidic, which keeps away, other bacteria, yeast infections. So the more you mess with it, the more you are actually likely to cause things like infection. So this is why we tell people do not douche, like never ever wash in the vagina, because you're actually disrupting that microbiome, and that's going to lead to more problems. It's actually a self-perpetuating cycle, especially with those washes and douches. Like you use the douche and then you get a yeast infection, you feel like, oh, I must need to keep it cleaner, and then you use it more and things get more and more irritated. So in general, you don't need anything like that. It's just a waste of money. Like
Mhm.
if you want to take a vitamin gummy for other reasons, for just plain vitamins, then that's great. But you don't need special vagina gummies to keep yourself healthy or
So
smell
you're
better,
saying the
whatever.
vagina is
Yeah.
a self-cleaning organ, right?
Yeah, self-cleaning oven. We all say that. It's a crazy expression, but it's true. It's just leave it alone. It does its own thing. If you want to wash outside on the vulva, the skin and the vulva labia on the outside, then you can just wash with water or just like a fragrance-free soap.
Mhm.
That's all you need. You don't need special feminine washes or like deodorizers and all that stuff. You don't need any of that.
So I guess this last real or sus, I pretty much know the answer, and that was real or sus. Vajacial masks are like facials for the face, and you should do them.
No, God.
Those I assume vajacial masks are
Oh
sus, then, aren't they?
my god, so sus. And they're
They're
so
about as
expensive. When
sus.
people tag me on
Oh,
that,
really?
they're like, like $50 for a pack. I'm like, who needs what? That's crazy. So again, they anything that has and they all have like chemicals. I think I looked at the ingredients list. It was like all like these like weird chemicals and fragrances and stuff like that, which are very
Yeah,
irritating. The vulva is very
yeah.
sensitive. It's most sensitive skin on your body. So if you put anything like artificial chemical, whatever, it's potentially going to get really irritated. You do not need it, and it can cause problems. To extrapolate that, also essential oils. Please do not put essential
Mm,
oils on your vulva. Like I've seen a couple people talk about like tea tree oil. I had a patient once with like
mm.
basically burns of the
Yeah,
vulva
that's
from
strong, though.
tea tree oil. Even diluted can almost like burn your skin. So definitely
Oh,
do
wow.
not do any special like people are like, oh, the essential oils are natural, but no, like they can be quite irritating. So
Hmm.
No
So I'm
vajacials.
here with Dr. Karen Tang. She's a board certified gynecologist. She's the author of It's Not Hysteria, Everything You Need to Know About Your Reproductive Health, But We're Never Told. If you could tell people, this is your first book.
Yes.
It's a very comprehensive book with lots of references. I mean, the book is over 350 pages long. You spent
Mhm.
obviously a lot of time writing this.
Ton of time. Yeah.
Why did you decide to write this book? And I mean, yeah, what got you into writing? I know every time I've written a book, I've had this kind of vision in mind of like,
Mhm.
why do I need to write this? Why did you decide to write It's Not Hysteria?
Yeah, I mean, just in the course of being a pain specialist, seeing patients in my office, and then going on social media and seeing the same things now millions of times over, the same experiences of women, people assigned female at birth. I do take care of, trans and non-binary people who have gynecologic issues.
Mm-hmm.
But so many of the same stories where it came down to, I was suffering for years and I had no idea that I had endo, I had PCOS, that this was perimenopause, that there was something I could do to take care of my health, or that they were trying to get help from a doctor but were dismissed. We're like, oh, that's just normal periods. It was so frustrating to see this. And I actually, I laugh about the social media thing. I actually was always more of like a writer and like somebody who's quietly like kind of like to just explain things in writing. The social media thing is almost like kind of crazy that it's happened. I love teaching on social media and video, but writing was always something that I felt very comfortable with, more comfortable than being on camera. So it made sense, once I got this platform with the social media, to then try and kind of take the message to a broader audience. People who may not necessarily be on TikTok or Instagram Reels, but are still out there kind of wondering, like, am I normal? Like, is this supposed to happen? Like, what do I
Mm-hmm.
do about this? I got a lot of questions from people about, now that I think I might have endo, where do I even go with that question? Like, how do I get care? So the book kind of sprang out from this desire to educate everyone. Is and I kind of joke, it's not joke, but it's not just for women, it's for everybody, because men probably have someone that they know who's suffering from a lot of these things. If you're going through, say,
Mm-hmm.
infertility, miscarriage, your partner is having horrible pain every month, don't know what to do. And there's chapters on things like like basic sex ed, like how does pregnancy happen, things that everyone should know about. I also have chapters on sort of hot button topics like abortion, gender affirming care, which, people are making laws, but they don't understand how this
Yeah.
stuff works. I don't, I am so flabbergasted that that's the case, that you have lawmakers who don't actually understand the mechanics of pregnancy, miscarriage, ectopic pregnancies, and are getting to make laws. So I wanted to kind of put this message out there, both to educate people, to kind of empower them to take control of their own health, and to help guide them towards getting the help that they need, but also just to help get a dialogue going, just like this, like you and I
Mm-hmm.
talking and demystifying some of these things. So much of sexual health and reproductive health, people feel like they're embarrassed to talk about it. Like they're like, oh God, I don't want to talk about, like, my vaginal symptoms, like my weird period heaviness, my period poops. Is that normal? I don't know. But just to kind of get this dialogue going, like, hey, so many people, millions of people have the same experience, and people feel very alone when they think that they're going through this, and just to help people realize that these are like almost universal experiences, and we should feel comfortable talking about it. One of my biggest hopes is that people will talk about this, like with their relatives, with their friends, like that they will feel comfortable being like, oh my God, like I read this chapter, and like 5 of us realized that we had the same issue. So just to kind
Mm-hmm.
of get a dialogue going on a bigger scale, and then hopefully, like in the dream of dreams, that this reaches some, lawmakers or funders or somebody who'd be like, oh my God, it is outrageous that we don't know what causes most gynecologic problems. Now we have like this White House initiative, maybe we can get some better funding for all of these things. So Jill Biden and Joe Biden actually published with my publisher. It's
Oh, wow.
obviously still hard to reach them, but I'm trying to see if we can get the book into at least Jill Biden's hands, to see if she'll read it. But
Well, I think
yeah, I have a big
it's so
mission with this
important.
book. Yeah.
Yeah, I think it's so important for people to realize that women's health is very complex and it's very nuanced,
Mhm.
and it's not something that you can just, hammer something, hammer the patient over the head like this is all you need, one
Mhm.
medication and you're fine.
Yeah.
That's unfortunately been the way that medicine has been for so long. And I
Mhm.
think, thanks to people like you and a lot of the other GYNs who are leading this fight, we are realizing just how complex and nuanced women's health is, and how it changes. You can't treat women the same way when they're premenopausal as if they're postmenopausal.
Oh,
absolutely. I mean, the body changes so much, and thanks to people like yourself, I think that dialogue is happening, and people, I think, are opening their minds to realizing, like, wow, we really need to put much more resources into helping women, so that we learn more about how women's bodies work, because we don't understand so much of it as it is.
Yeah, exactly.
How do people find your book, and how do people find you, Dr. Karen Tang?
Yeah, so the book you can get anywhere books are sold. I encourage people, ask your local indie bookstore for it. But also, if you go to my website, karentangmd.com, there's a link you can pre-order through there. And I don't know if you'll have like show notes, but we'll give people a link. So if they want to just like click on the show note for the pre-order, we actually have a pre-order campaign right now. If you pre-order and you upload the receipt, you actually get like a little sample of like some lube, like kind of fun, a little bonus there. And thank you so much. I was about to say, I really enjoyed this conversation. I have to say,
thank you.
I love the real or sus discussion.
we'll definitely put a link to order the book in the podcast caption. Make sure you realize that the book actually, this podcast goes out on a Monday, and your book will be out the next
Tuesday.
day. So depending on when you listen to it, it probably will already be in stores. So we encourage you to take a peek at it and pick it up. It's called It's Not Hysteria by Dr. Karen Tang. So I always finish the podcast by asking my guest, if you have one last piece of advice to leave our audience with, what would that be?
Oh, I love this. So basically, don't let people tell you that you're hysterical. If you are having health issues and you feel like someone's not listening, get a second opinion if you can. Find an expert. Sometimes it's just that the person that you're seeing doesn't know enough about that particular set of issues, hormone issues, pain issues. Try and look around, talk to your community, talk to other people who may be going through similar things. Try and find a specialist. You deserve to get good care, and you deserve to treat the things that you're going through, and you deserve to be listened to. So definitely don't be discouraged, and keep on fighting. And hopefully, like I said, our medical system will change so that we will support everyone and they won't have to fight quite so hard. So
yeah. Well, great advice. Thank you so much for joining me. I really appreciate it.
This was so much fun. Thank you so much. I've really had a great time.
Thank you so much for watching. My name is Dr. Anthony Youn. I'm known as America's Holistic Plastic Surgeon, and this is the Holistic Plastic Surgery Show. And as always, eat real food, use clean skincare, and autojuvenate before you operate.